When it comes to birth control, let's be honest right now, what usually comes to your mind? Women, right? We hear of pills, implants, injections. But have you heard of vasectomy? The safe birth control option for men, and they don't talk much about it. And no, vasectomy is not castration, also known as acute. Don't confuse these two. So in today's video, I will explaining what exactly vasectomy is, what really happens during the procedure. So if you're coming across my channel for the first time, you are welcome. Do it to subscribe so that you'll be notified anytime I post a new video. My name is Uchechi Chizendu and I'm a clinical physiologist. Now, if you enjoyed this video, let's get along. Let's dive in. Vasectomy. Now, before I go into what vasectomy really is, I want you to have a background knowledge of what the male physiology, that's the male reproductive physiology really is. Now, you need to understand that the sperm is produced in the testes. The testis does not store the sperm, it only produces the sperm. Now, the sperm is matured and stored in the epidermis. When it is produced in the testes, it is transferred into the epidermis where it is stored and matured. Now, you need to understand that during ejaculation, that's during sexual activity, when you are fully aroused, the epidermis contracts and pushes the sperm to your vas deferens. The vas deferens is a muscular tube that actively transports sperm by rhythmic contraction into the ejaculating duct. The ejaculating duct is where fluid from seminal vesicles and prostates are added to form semen. The semen then passes through the urethra and is ejaculated out. In fact, let me not bore you too much with too much grammar. I just want you to take note of something. The vas deferens. You need to understand that the vas deferens is what connects the epidermis to the ejaculating duct. Then from the ejaculating duct, it is where sperm is ejaculated out through the urethra. The main job of vas deferens is to transport sperm and not sperm production. Now, it transports sperm from the epidermis where sperm is stored and matured to the ejaculating duct where it is ejaculated out through the urethra. Now, take note of that because I'll be coming back to the vasectomy, the procedure involved in vasectomy. Now, you need to understand that the urethra is where urine and sperm passes out. So, what exactly is vasectomy? Vasectomy is a permanent form of birth control for men. It is a simple medical procedure where doctors block or cut two small tubes that transport or carry sperm, which is the vas deferens. Remember, I mentioned vas deferens. The main job of this vas deferens is to transport sperm, not to produce sperm. So in this procedure, this tube is either blocked or cut. So after vasectomy, the man still produces sperm. Remember, the tubes that carry sperm is the one that was blocked or cut, not the organ produces sperm, which is the testes. The testis is not harmed. The testis still produces sperm. This is what makes vasectomy different from castration. Castration is a medical procedure where a man's testicles are removed. Remember, the testis produces sperm, so that is different between vasectomy and castration. In castration, the testis that produces sperm is removed. While in vasectomy, the testis is not removed, it's still there, can still produce sperm. The difference is that the tubes that carry the sperm to the ejaculating duct, where it will be ejaculated out, is either blocked or cut. So a man that has undergone vasectomy can still produce sperm, can still ejaculate semen. Yes, you heard me. Can still ejaculate semen. They can still enjoy sex, but the sperm cannot mix with the semen, so pregnancy cannot happen. That's the whole idea. So let's get the biggest misconception about vasectomy. Vasectomy does not reduce sexual desire or sexual strength. It does not affect your libido, does not affect your orgasm or even your erection. It does not affect testosterone level or muscularity. Your testosterone level stays normal, untouched. The only thing that it does is that it prevents pregnancy because the tubes that connect this sperm is blocked or either cut. And yes, you will see ejaculate semen, but just that sperm will not be inside. So if sperm is not inside your semen, how will fertilization occur? How will pregnancy occur? No, it won't. While for castration, sperm production stops completely. In fact, castration affects your testosterone level because it drops significantly. Castration reduces sex drive, it kills your libido, and one thing again is that it weakens erection. You might have difficulty having erection if you are castrated as a man. It causes hormonal changes, and this can affect physical looks, physical changes over time, how man is built, because that muscularity, that testosterone is reduced in castration. So don't confuse castration with vasectomy. They are totally different. A lot of people think vasectomy is a big surgery. It is not. A lot of vasectomies are done under local anesthesia. Local anesthesia, they don't numb your entire body. They numb only that part of the body that they want to operate. So in local anesthesia, they will just give you an injection to numb that particular area they want to operate. They'll give you an injection just so that you will not feel pain. So you will even be awake during the surgical operation. So this procedure can take about 15 to 30 minutes. It doesn't require hospital admission. So you can walk in that day and get your surgery done and still go home. No long hospital stay, no dramatic recovery, because it's a simple procedure. So no, this is not painful or dangerous procedure. Now you need to understand something. Vasectomy does not work immediately. Sperm may still be in that semen for some time, so the man must ejaculate several times over the week. Doctors usually advise waiting about 3 months. So after 3 months, you go back to the hospital again. They take your semen, run you some tests to make sure that there is no sperm still left inside your semen. Until that confirmation, other form of birth control can still be used. Until doctor confirm there is no longer sperm in your semen, then you know that the surgery is successful. Now for effectiveness, vasectomy is over 99% effective. That makes it one of the safest and most reliable birth control method in the world. Once it is confirmed successful, pregnancy becomes extremely impossible. Now there are cases where after vasectomy still pregnancy occurs, but that is the exception. That is a rare case, because in every rules there will be an exception. So in vasectomy, no daily pills, no monthly injection, no forgetting to take your medication or your meds. It just works. Now, before you have vasectomy, vasectomy is ideal for men who already have children and they decide not to have more. Couples where pregnancy may be risky for the woman, maybe when the woman gets pregnant, it can endanger her life. Or even couples who decide to be child-free for life, like they don't want to have children, then they can go for vasectomy because it is less complicated, like it has less complication compared to implants, compared to other family planning for women. So it's a kind of shared responsibility approach to family planning, because women usually their family planning, they have other complications. Some affect their hormones, can cause hormonal imbalance. Some women will bleed for months, some will not see their period for months. So for couples that don't want to have kids, or maybe already have children, or maybe just decide to be child free, you can consider vasectomy. Now let's address some common myths about vasectomy. That myth number one, this says does vasectomy makes a man weak? Does it actually affect men's ability or strength? The answer is no. Vasectomy does not affect a man's ability or strength. And number two myth says does men stop ejaculating after vasectomy? Well, the answer is no. Men does not stop ejaculating after a vasectomy. Vasectomy does not affect your ejaculation. You will still ejaculate semen, but just that sperm will not be inside. So vasectomy does not stop ejaculation. And number three myth says, does vasectomy affect hormones? Well, the answer is no. Vasectomy does not affect men's hormone. It does not affect testosterone. Your testosterone level stays normal, the way it should be, or maybe the way it is in your body. Vasectomy, this procedure does not affect your testosterone. So most of these fears comes from misinformation and not medical facts. Vasectomy is not for everyone, and that is absolutely okay, because this is a permanent procedure, but it should not be feared or even misunderstood. It's one of the safest birth control options available, and it gives couples peace of mind. especially when they are done having children, when they are done having kids. They don't want more children. Family planning works best when it is shared. So if you hear about family planning, you shouldn't only think about women. There are several options when it comes to family planning. If this video was helpful, it makes you to understand vasectomy better. Don't forget to give a thumbs up, like, subscribe, and share. Bye.